Hello guys, I am Sagar Sonone and today's video about the blood cell blood disorders, means different types of blood cells and their disorders. For example, red blood cell disorder, white blood cell disorder, platelets disorder, and then blood clotting disorder. Okay, so first of all, you can talking about the red blood cell disorder. So red blood cell disorder that affect the body's red blood cells, and those are the cells in our body, the blood that carry oxygen from lungs to the rest of the body. And there are a variety of diseases which can affect the both children as well as the adults. So first disease in the red blood cell disorder, there is anemia. So anemia is a red blood cell disorder, a lack of mineral iron in the blood is a commonly caused disorder, and the body needs iron to produce protein, hemoglobin, which helps your RBCs that carry oxygen from lungs to the rest of your body. So in the anemia, there are different types of anemia, like iron deficiency anemia, pernicious anemia, aplastic anemia, and sickle cell anemia, and also different types of anemia can be classified in the anemia. So first of all, we can talking about the iron deficiency anemia. Iron deficiency anemia means that is due to the deficiency of iron. This anemia can be occur in the body does not have enough amount of iron. So you feel tired and shortness of the breath because RBC is not carrying enough oxygen to our lungs. So iron supplementary usually cures these types of anemia. So the symptoms of the iron deficiency anemia, that is the shortness of breath and feel tired, and the treatment for this iron deficiency anemia, that is a iron supplementary can be used. Then aplastic anemia. Aplastic anemia is a rare but serious condition in which bone marrow stops making the enough new blood cells, and it occurs suddenly or the slowly at any age. Okay, so for so it feeling tired and unable to fight off infection, and uncontrollable bleeding, that is the symptoms of the aplastic anemia. And next is a autoimmune hemolytic anemia. Autoimmune hemolytic anemia that causes your immune system destroy red blood cell faster in our body, and they can replace them. This should having too few RBCs. And then last is the sickle cell anemia. Sickle cell anemia is a type of anemia that draws its name from the unusual sickles shape of affected RBCs due to the genetic mutations. Red blood cell of the people with the sickle cell anemia contain abnormal hemoglobin molecules which leave them rigid and cover the sickle shape RBCs. Okay, now we can talking about the disorder related to white blood cell. So in the white blood cell defined as the body against the infection and the foreign substances. And a white blood cell disorder your body's immune responses and your body's ability to fight with the infection. They cannot be have this ability due to this white blood cell disorder. So example, lymphomia is a blood cancer that occurs in the body's lymphatic system. White blood cells change and grow out of control. Hodgkin's lymphoma and not Hodgkin's lymphoma are two major classifications of the lymphoma. And the second disease related to the white blood cell, that is a leukemia. Leukemia is a blood cancer in which malignant white blood cells multiply inside of our body's bone marrow. And leukemia may either be acute or the chronic, and the leukemia chronic is advanced more slowly. Then next disorder related, that is a platelet disorders. Body's blood platelets are the first respondable when you have to cut or other injuries. They gather at the site of the injury or the cut and creating a temporary plug to stop blood loss. if you have platelet disorder, your body, your blood has a one of the three abnormalities, that is a not enough platelet, too many platelet, and last is a platelet that do not clot correctly. So not enough platelet, having too few platelet is a quite dangerous, and because of the small injury they cause serious health problem, means serious blood loss. Okay. Next is a too many blood clot, too many platelets. Okay, if you have too many platelets in your body, blood clots can form and block the major artery and causing a strokes or the heart attack. And last is a platelet that do not clot correctly. Sometimes deformed platelet cannot be clot correctly, so blood cells or the walls of the your blood vessels, means capillaries, arteries or the veins, so cannot be clot properly, and they also leads to a dangerous loss of the blood. So this is related to the platelet disorder. First is the hemophilia. Hemophilia is a probably best known blood clotting disorder. It occurs almost in only men, and the most serious complications of the hemophilia is excessive and prolonged bleeding. This bleeding can either be inside or outside of the body. Due to this inside of the body, blood tumor can be happen, or too many blood can be stored into the brain, and blooding cannot be start for no appropriate reason. And treatment for the hemophilia, that is a hormone called dysmorph dysmor dys dysmorphis for a mild type A, which can promote release more and reduce the clotting factors. And infusions of the blood plasma, infusion of the blood or the plasma for the type B and type C hemophilia. So next is a thrombocythemia. Thrombocythemia is a rare disease that can lead to increased blood clotting, and this puts higher risk for the strokes or the heart attack. And disorder occurs when bone marrow produce too many platelets. Okay, so acquired platelet function disorder, the certain drugs and medical condition can also affect the functioning of the platelets, but be sure to coordinate all the medications with your doctor. Even you even over the counter once you choose yourself. The Canadian Hemophilia Association warns that the following common drugs may affect the platelets, especially taken a long time. For example, aspirin, non-steroidal anti-inflammatory drugs, some antibiotic, heart drugs, and antidepressant, anesthetics, and the antihistaminics. Okay, so that is the three types of blood disorder. Now we can talking about the blood clotting disorder. Blood clotting disorder affect the platelets of your clotting factors, means coagulation factors. Clotting factors are the protein in your blood, and platelets and the clotting factor makes blood clots, which control the bleeding. Blood clotting disorder may be called hypercoagulable state or the thrombophilia. Blood clotting disorder include the prothrombin gene mutation. Prothrombin gene mutation is a inherited disorder, increase the risk of the developing abnormal blood clots in your veins and the lungs. Next is the antiphospholipid syndrome. This is a rare autoimmune disorder which affects people when you have lupus, and then cause blood clots in the several area of your bodies. Next is the protein S deficiency. Protein S deficiency is a normal anticoagulant in the blood. Anticoagulant prevent blood from the clottings, and the protein S helps keep the other proteins for making the too many blood clots. It is a rare inherited disorder. Next is a protein C disorder. Like protein S, protein C is a natural anticoagulant that protect you from developing too many blood clots. Okay, so now we can talking about the common symptoms of the common symptoms of the common symptoms and the causes of the blood cell disorder, that is increase the, for example, any people have the anemia, so they have symptoms like fatigue, weakness, dizziness, skin that's paler than unusual, fast heartbeat means heart palpitations, and shortness of the breath. And the common bleeding disorder, that is a nose bleeds, excessive bleeding, internal bleeding, brushes, post surgery bleeding, heavy periods means menstruational bleeding, blood in the stool, blood through the urine, blood through the and the uh, common blood clotting disorder symptom, that is a swelling, chest pain, heart attack, strokes, and most common causes of the blood disorder. There is a no single causes of the blood disorder. Some people have a inherited blood disorder and other blood disorder that can happen because people develop a condition that affect their blood. And we can talking about the test for the blood cell disorder, that is a hemoglobin test, hematocrit test, reticulotic test, and for the white blood cell test like the platelet test, mean platelet volume test, and the peripheral blood smear test are the test for the platelet. And for the treatment, uh, blood and platelet transfusions, then anticoagulants, growth factor supplementations, and corticosteroids are the treatment which can we use for the blood cell disorders. They can include all red blood cell disorder, clotting factor, blood clotting factor disorder, platelet disorder, and white blood cell disorder. So in this video, all the information related all disorders of the blood cells and their symptoms, causes, and treatment. So thank you.